we're continuing this book here, The Hidden History of Nutrition and Health by me, Pete Rogers. We're on the section now about the blue zones. And really what we're talking about here is epidemiology. This is Dan Buettner from National Geographic. He did a great job writing this book and filming a documentary about traveling to what he calls the blue zones. And these were described as areas where people have the longest lives, the highest percentage of people who've lived 90 years, noninarians, and 100 years of age, centenarians, okay? And some of the two most popular ones are Okinawa, which is sort of like what Hawaii is to USA. That's like what Okinawa is to Japan. It's an island related to Japan. And on that island, the people live longer than they do in Japan. And Japan's pretty long-lived, very long-lived for a country, especially back in the day, let's say 1970s and 80s. Despite the fact they smoke like chimneys. The other thing that would get the Japanese in trouble, they eat tons of salt, 12 to 14 grams a day. But in Okinawa, they didn't have as much salt, and that's thought to be the reason. And they also ate more sweet potatoes, thought to be the reason why they live longer than the mainland Japanese people. Okay, so anyways, some interesting things about the blue zones. He talked about back in the time when he originally gave his lectures, he was saying they ate 95% or more of plants. Later on, he dialed it down to saying 90% or more plants. People are always pressured to back off on veganism if you want to get interviewed on popular channels. And he's a pretty charismatic guy. Okay, what else? Jeff Nelson over at VegSource did a video about Okinawa and how that data is good. And there were also a couple PhD scientists, brothers, that have gone and studied them in some considerable detail. And we're also impressed with the Okinawans, and the idea of Shangri-La, the land of the immortals, was thought to be Okinawa. Okay, and after World War II, they're kind of hungry. A lot of them are almost starving. So overeating wasn't a problem. Nowadays, Japan, like a lot of Asian countries, are being more westernized. They're eating more fried food, more meat, more processed food, and they're getting fatter and sicker. As a matter of fact, Tetsumori Yamashima, a Japanese MD PhD researcher, thinks that there's a big increase in the amount of dementia in Japan, and he thinks it's from eating more and more fried food. That's also the main thing that gets people from India in trouble, eating too much fried food. Fried food is much worse for your health than is widely realized. Okay. Another area where the people were doing really well tended to be in Seventh-day Adventist populations in Los Angeles, like around Loma Linda. And it's part of their religion, going back to Ellen White, to eat a primarily plant-based diet. And that guy over at MedCram, Roger Seaholt, really smart guy, gives all the lectures about sunshine, sunlight, and sleep medicine. He was raised a Seventh-day Adventist. Not a strict guy. He did eat some meat when he was young, but still, he sort of came up in that tradition. Okay, let's see. Here's a picture of these places there. So here would be like Japan, here's Hawaii, here's Okinawa, like the Hawaii of Japan. And the reason I show you this drawing is Japanese people would often migrate to Hawaii, the Hawaiian Islands, and then later to Los Angeles or California somewhere, to the West Coast. And the point of it is, when they were eating their old-fashioned diet, Dr. McDougall showed pictures of this. He would show the grandparents all healthy and skinny and looking good for their age, and then the parents that had been more westernized, the middle generation, being fatter and sicker, and then the kids being little Oompa Loompa fatzos because they eat a more westernized diet. Okinawa, they had 5 times as many centenarians as the USA. That's a lot. They used to eat tons and tons of sweet potato, very low in salt. They were farmers. I actually met an Okinawan patient one time, and he told me, most of them are farmers. They don't have any cars. They walk all the time. They have very close families, little family groups. They call it an ikigai. They try not to eat till when they're completely full, just till they're about 80% full, then they stop. Because of their close families and their social groups that are tight, they have good support systems. That makes a big difference. They often live in the same general area their whole life, so they keep their friends for life. In the USA, people move all over the place. There was something called the Rosetto effect. Rosetto, Pennsylvania, a bunch of Italians with extended families, and they'd be demographically matched to other populations, and for disease, alcoholism, smoking, and all that, and they would live much longer. It's because they're all in the same house helping each other. So Luigi loses his job downtown. He's a little sad, but the family feeds him and houses him until he gets a new job. Versus if Luigi's by himself downtown, loses his job, he's screwed. He can't get any food. He can't pay for a place to live. So that family social support system really can benefit a person a lot, especially during difficult times. Many of these centenarians in Okinawa were still pretty fit and healthy. You know, I saw some of them doing push-ups when they're over 100 years of age. And Dr. McDougall had said, yeah, lots of these centenarians and noninarians, they'd often not even go to a doctor until the last 5 or 10 years before their death. Okay, going to doctors is overrated. You go to doctors when you're sick and you have a real problem. But, you know, going for checkups is dangerous. You get pushed into a screening study, all of a sudden, you know, you're got an incidentalloma and you're followed for 2 years, 5 years, cost you a lot of money. Don't get me wrong, there's some things that are good to check. You want to know your blood pressure, you want to know your total cholesterol, it's good to know your serum ferritin. There's some other things you're going to want to maybe know. Okay, let's see, what else can we say? And the big thing about all these studies show the same thing. Populations who eat low-fat, plant-based diets, they don't ever get obesity, hypertension, diabetes, coronary artery disease, very low rates of, or next to nothing, abdominal pressure syndrome, you know, Burkitt's disease. And they have very low rates of cancer. And then you see the migration studies. The more they move towards the West and start eating a westernized diet, the fatter and sicker they get. So it's not genetic. None of this stuff is genetic. None of the common diseases are genetic. I almost never see genetic disease. Yeah, I'm aware it exists, but it's a rare thing. You know, when you hear hoofbeats, think of horses, not of zebras. Okay, what else? I think that's all I'm going to say for now, but like I said, it's the same with any population. All over the world, like Dr. McDougall had said, all large healthy populations are starch-based, primarily eating plant-based diets. There's no exceptions. McDougall tells you the truth. McDougall was a smart old guy. The guy was a genius, first in his med school class, and, you know, here he is. He comes from Podunk, okay? Nobody's ever heard of some crappy little med school in Detroit, and does his residency someplace in Hawaii. Nobody's ever heard of him. Meanwhile, all these Ivy League docs, all they know is drugs. Okay, McDougall, basically, Kempner showed you that the low-fat vegan diet with rice and fruits cures all the common diseases or prevents them, diminishes the severity of them at worst. And McDougall showed you can make it easy. Kempner's patients had to be monitored because it was such a strict diet. Risk of hyponatremia, for example, whereas McDougall showed just eat a starch-based diet, 90% of your calories from starch, 5% from fruit, 5% from veggies, and you can reverse most of these diseases and prevent them. So anyways, hope you found that helpful.